part 4, I guess it is. So there are some thoughts of facilitators in rehab. That is, what things can we utilize in rehabilitation that will enhance the recovery of patients in rehabilitation? So there's no magic bullets. Okay, there's a lot of patients who ask us, you know, if I take this medication or if I do this certain therapy, will I be guaranteed to recover my arm function or to regain all what I could do before? Well, the answer is no. But there are things that seem to help. And what we have utilized are some medications that seem to facilitate basically learning. So it may not directly improve or enhance motor or sensory recovery, but it enhances the ability to learn, to focus, to maintain attention, and therefore to sustain their ability to do rehabilitation. And these are the adrenergic agents, such as the stimulants such as methylphenidate or Ritalin, dextroamphetamines, even some of the dopamine agonists such as amantadine. So some of these medications have been utilized, and it certainly seems that it helps the patient sustain attention better. Sometimes it can even improve their memory, and therefore it facilitates learning and again facilitates the rehabilitation, the ability to maintain the rehabilitation treatments. There's a theory of constraint-induced therapy, and this developed in the 1980s, in which there was a thought that after a patient has a stroke, it's not necessarily that the weak side has been affected so severely that they're paralyzed. It is actually that even though it has been, the extremity has been affected, the patient tends to use the stronger side much more favorably, and therefore compensates for the impaired extremity. In this process, therefore, what happens is that the weaker or the impaired extremity gets weaker, gets in a sense disused, and is in a sense neglected. And so it will never improve. And in that regard, it's kind of like that use it or lose it. So that the theory is, if a patient has the good side or the stronger side restricted or restrained, then it forces them to use the impaired side. And by this, it demands that the weaker extremity has to be utilized, and therefore, hopefully, can regain strength and movement and function. There have been varying degrees of success with this. It does seem that it seems to help as long as there is some function left in the impaired extremity. However, the degree to how much it improves is still somewhat questionable. I'll talk about enriched environments, motivation in the mind, and new research in STEM therapy that has been going on. Okay. So enriched environments. So there have been studies, psychology studies, in which they have found that animals, particularly mice or monkeys, who have been raised in environments that were very supportive and nurturing, with the trainers there to play with the animals and nurture the animals with good environments, develop larger brains, develop better biochemical structures, and actually adapt better to stressors and different harsh or challenges to them, as opposed to those who are raised in bare cages with minimal food, with minimal involvement or interaction, with minimal support. Those do not develop very well. And so this has been adopted to in a sense, the rehabilitation field, in which it seems to help. This enriched environment, a supportive environment, helps with recovery after injury. And so what they have shown is that patients who have better support, family support, and a more nurturing environment, such as within a rehabilitation setting, do better than those who have been neglected, who have poor family support, who are not involved with any type of rehabilitation strategies. And you can see this, it's pretty obvious when you see patients and other populations who have been neglected, who do not have the opportunities, do not have the resources, that indeed their outcomes are worse than those that have those resources. Again, what we also see is those patients who have better family support do much better, not just in terms of motor recovery or sensory recovery, but adaptability to their disability. Which brings up motivation. So patients who are more determined to recover seem to do better. And probably the reason behind this is that if a patient is more determined to get better, they will be engaged more with the rehabilitation process. They'll be more enthusiastic in doing the treatment every day or as frequently as they can. They're more willing to get up and start walking or utilizing their arms or legs and start doing the functional tasks again. So determination and persistence certainly make a difference. Also, there are theories of the role of the mind and the human will. And again, you know, if you think about it, again, because it probably motivates them to do the exercises, to do the therapy, to do these activities, these functional tasks over and over and as much and as frequently as possible so that they can regain their as much function as possible. As I already mentioned, the support and nurturing of others helps with the motivation as well. And then there's patience. So certainly you can have a very gung-ho, motivated patient, but it doesn't help if they beat themselves up and get frustrated with themselves because they can't improve as quickly or to the extent that they want to. And so again, it takes patience and encouragement from others, as well as the patient, him or herself, that they can try and get better. Because if a patient gets very frustrated and discouraged, then basically what it is doing is it's impeding their ability to rehabilitate. So there has been research that has been attempted to improve recovery. Aside from these other facilitating factors, there's now research being done that hopefully can assuage many of the effects of a stroke. In the 1990s, there were preliminary studies showing evidence that precursor cells, in a sense, the precursor stem cells, they didn't have stem cells back at that time, but they had precursor cells that may actually enhance recovery of function. And these cells were implanted into the brain, and it did seem to show that some of the patient actually did improve in their function and recovery. In the 2000s, that's when stem cells started coming out, and again, it showed even better promise of potential recovery with cells that were implanted into the brain. There have been preliminary studies now in which magnetic cortical stimulation over the brain may improve rehabilitation recovery as well. And then there have also been interventions such as video gaming and virtual reality, which have been introduced into rehab therapies, which also seem to help improve recovery. And that's mainly because it gets the patient more involved with fun therapies in a sense. So it's one thing trying to get up and walk and with a therapist in the gym in an artificial setting, but it's a lot more fun if you try to have a patient play tennis with a video game, and get them more involved and more relevant in a more relevant and functional task that they would enjoy. So in summary, the purpose of rehabilitation after a stroke is to retrain the person to regain as much function as possible. And again, there's no guarantee, but if you don't try, there's no hope of regaining any function. So we try to regain as much function as possible. And in that regard, help the patient be as independent as possible, or at least require the least amount of assistance. And avoid bad behaviors or movements in the process. So again, what we are trying to do is have the patient regain as much of a quality of living as possible, to enjoy themselves, enjoy their family, be reintegrated back into society, their community, and be able to continue their pursuits, whether it be leisure, whether it be school, whether it be a job. We went over different types of therapies: the physical therapist, occupational therapist, speech and language pathologist, neuropsychologist, recreational therapist, all who have very integral parts of rehabilitation to help the patient get better. You discussed different learning processes, and probably the most significant was that the patient has to go through repetition, repetitive movements, repetitive therapies, frequently and constantly in order to regain function and the ability for the person to remember what they have learned. We discussed different facilitators of recovery, different medications, different theories of therapy, and new and upcoming research, especially in terms of stem cell implantation, to see if that may improve recovery as well. So I want to thank you for listening. I hope this was knowledge gaining, and certainly if you want to gain more knowledge, repeat, repeat, repeat. Thank you very much.